Welcome to the Medicare Educational Video Overview. The following presentation will be an overview of Medicare and the programs associated with it. If there is a discrepancy in this video, please refer to your Medicare NU handbook. Let's get started. You have entered into a new phase of life. It's a time to enjoy the fruits of your labor. Maybe it's time to pick up a hobby or do some long-awaited travel. Financial security during retirement should be at the top of your list. Signing up for Medicare is a very important decision to make, and we are here to help you make that right decision. So what is Medicare? A little Medicare history. In 1965, the Social Security Act established both Medicare and Medicaid. Medicare was extended health coverage to almost all Americans age 65 or older. There was a change made in 1972. The Social Security amendments expanded Medicare to provide coverage to two additional high-risk groups: disabled persons receiving cash benefits for 24 months under the Social Security program, and persons suffering from end-stage renal disease. Congress added Medicare Part C, which today you may know it as Medicare Advantage, which allows enrollees to receive their Medicare benefits through a private plan. On December the 8th of 2003, President George W. Bush signed the Medicare Prescription Drug Improvement and Modernization Act into law. Part D went into effect on January the 1st of 2006. So who administers Medicare? You may see commercials on TV talking about CMS. That's the Centers for Medicare and Medicaid Services. And CMS is a component of the Department of Health and Human Services. So what are the working parts of Medicare? You will hear about Part A, Part B, Part C, and Part D. And all these parts may get confusing, but that's why we're having this educational video, and we're here to help you in any way that we can. And we're going to go over shortly here, what are those parts and what do they do? So what is Part A? Part A helps to cover hospitalization, skilled nursing facilities, hospice care, and home health. Part D does have a deductible, and that deductible does change a little each year. Part B helps to cover your doctor's appointments, outpatient care, preventive services, occupational and physical therapies, and home health. And also note, and this will explain some things as we go on through the slides, but Part B also has a deductible. If you turn 65 prior to January the 1st, 2020, you still have access to a supplement plan that can cover this deductible. If you turn 65 after that date, that type of plan is going away. Part C, like I mentioned earlier, is Medicare Advantage. Offers health plan options. It's run by Medicare-approved private insurance companies. You see these on TV often. Most Medicare Advantage plans cover Medicare prescription drug coverage, also known as Part D. Part C, or Medicare Advantage, covers everything that Medicare Part A and Part B cover. Some of those plans include services like dental, vision, wellness programs, meals after inpatient hospitalization, transportation services as well. And these services and additional services will vary by carrier. You must have both Part A and B to enroll. Part D, prescription drugs. This helps to cover the cost of medications. We all know that medications are not cheap, and we need help in covering the cost of those. It may help lower your prescription drug cost and help protect against higher costs. Part D plans may have an annual prescription deductible. Some do, some don't, and you get the option of choosing what type that you want. It's run by Medicare-approved private companies, and there are plenty of them out there to choose your Part D coverage through. Each Part D plan has its own list of covered drugs, so choose the one that includes medicines that you take regularly, and that's very important. When you sit down and look at a Part D plan, you need to see where it falls on their list, where your cost will be, and if it's covered at all. So that's important information to have. So when you look at those kinds of things, definitely have a list of your medications, the strength, how many you take of those per month. Most Medicare drug plans have a coverage gap, also known as the donut hole. That means that there's a temporary limit on what the drug plan will cover for drugs. Not everyone will enter the coverage gap. The coverage gap begins after you and your drug plan have spent a certain amount for covered drugs. This amount may change each year. And that's why it's important to make sure the drugs you're choosing or the medications you're asking your doctor to prescribe are generic or lower cost medications that you're able to take to keep those costs down. Now, your Medicare Choices, it comes down to whether you want original Medicare, which again has Part A, your hospital insurance, your Part B, like your medical insurance, like your doctor's visits. With original Medicare, you have the option of a Medicare supplement and an option for a Part D or PDP plan. And then you have the option of the Part C, like we mentioned earlier, the Medicare Advantage plans. It combines Parts A, B, and usually Part D. In those plans, you can get a prescription drug plan included. You may not obtain a Medicare supplement when you're on a Medicare Advantage plan. And like I said already, may be able to add Part D to it as well. Signing up for Medicare A and B. Some people will get Part A and Part B automatically if you already get benefits from Social Security already, or the Railroad Retirement Board. You will automatically get Part A and Part B starting the first day of the month you turn 65. And if your birthday is on the first day of the month, Part A and Part B will start the first day of the prior month. If you are under 65 and disabled, you automatically get Part A and B after you get disability benefits from Social Security or other certain disability benefits from the Railroad Retirement Board for 24 months. If you are automatically enrolled, you will get your red, white, and blue Medicare card in the month 3 months before your 65th birthday or your 25th month of disability. If you're close to 65 but not getting Social Security or Railroad Retirement Board benefits, for example, you're still working and you want Part A or you want Part B, you'll need to sign up. If you're not eligible for premium-free Part A, you can buy Part A and Part B. You can contact Social Security 3 months before you turn 65. That being said, most people will get Part A at no cost. And generally, if you worked at least 10 years or 40 quarters and paid Medicare taxes while you work, you're eligible for that premium-free Part A. So when can you sign up? You have an initial enrollment period. You can sign up when you're first eligible for Part A and or Part B during your initial enrollment period. Here's the example. If you're eligible when you're turned 65, you can sign up during the 7-month period that begins 3 months before the month you turn 65, includes the month you turn 65, and ends 3 months after the month you turn 65. If your birthday is on the first day of the month, Part A and B will start the first day of the prior month. Important dates to remember. October the 15th through December the 7th is the annual election period for Medicare Advantage plans and your prescription drug plans for the next calendar year. So when you select those plans, every year you'll have the option to change those plans, especially in your Part D. The carrier may longer cover your medication. You may look on a different carrier to see who covers that or covers that at a lower cost. Also, a special enrollment period. Generally, it's outside of these time frames of the annual enrollment period. You can only make changes to your plan due to special conditions like moving out of the area, say you've moved, leaving an employer group, or you had Medicaid coverage. Costs associated with Medicare on the Part A. Typically, like I mentioned before, if you've worked and paid in, that premium is usually $0. There's a deductible that goes along with Part A that generally increases each year. There's no copayment for days 1 through 60, each benefit period in the hospital. There's a flat dollar amount for days 61 through 90 for each benefit period, and this amount generally changes also each year. For all other benefits, you can see the latest edition of your Medicare and You. If you don't have a copy, you can obtain from any Social Security office or online. Part B, premium per month that generally increases each year. One thing to keep in mind that cost varies based off income. Somebody somebody may be telling you they're paying $140 a month, and somebody else, you may know somebody says, hey, I'm paying $400 a month. Well, that's because they made a lot of money, and it's based off their income, their tax filing. So, but generally most people, a majority of people pay the same amount each month. Deductible does apply, and that varies each year as well. The doctor copay is 20% of Medicare approved amount. Outpatient services, 20% of Medicare approved amount. Part C, the Medicare Advantage. The cost associated with this is going to be all your premiums, your deductibles that go along, any copays that are set by that plan. Part D, prescription drugs. Again, all the premiums that you're going to need to pay per month if you choose a plan that has deductibles, and also the copays that are set by that plan. Medicare supplements. You need more coverage than Medicare Part A and Part B. A Medicare supplement plan may help cover some unexpected healthcare costs. Are purchased to offset some or all the costs that remain from original Medicare. Some examples of why you would have a supplement plan is to pay that Part A deductible and the 20% co-insurance that's going to come from that hospital stay. Again, you cannot use a Medicare supplement with a Medicare Advantage plan. There is a monthly premium associated with all Medicare supplement plans. And the good thing is the benefits are standard across the industry. They're standard between each carrier, but the premiums are not. So that is why it's a good thing to shop those around and take a look at who's competitive in your market. And that varies by market on who's competitive. A review of your Medicare options. Option 1, again, original Medicare. Medicare Part A helps cover hospital and other inpatient costs. Medicare Part B covers doctor and other healthcare provider costs. Together, they're original Medicare. So it's available through the federal government. So that's option 1. You can just have original Medicare with Part A and Part B. Option 2, you can have original Medicare plus a Medicare supplement plan plus a prescription drug plan, a Part D. So you can option 2, original Medicare, get a Medicare supplement and a Part D plan. Option 3, a Medicare Advantage plan. It includes Medicare Part A and B, frequently includes extra benefits and services. It may include a Part D drug plan as well. And those Medicare Advantage plans are available through private companies as well. And then you have option number 4. Original Medicare, you can get just like option 1, plus a prescription drug plan. And those prescription drug plans are available through private companies. So those are your 4 options to keep in mind as you go forward and what really is beneficial for you. Again, everybody's different, so you need to look at what's going to benefit you and your family. All right, there's some options here on Medicare savings programs. You may receive help from the state paying your Medicare premiums. In some cases, the Medicare savings programs may also pay Medicare Part A and B deductibles, co-insurance, co-payments if you meet certain conditions. And those conditions, what you need to do is contact your state Medicaid program to see if you qualify for that assistance. And then there's also low income subsidy for Part D. Medicare beneficiaries can qualify for that extra help with their Medicare prescription drug plan cost. To qualify for that extra help, you must be receiving Medicare, have limited resources and income, and reside in one of the 50 states or the District of Columbia. So to see if you qualify for that low-income subsidy for the Part D prescription drug plan, you need to contact Social Security at the number listed here just to see if you qualify. So that being said, this is at HFC Benefits, and you see our number listed below. A couple of closing notes. This video was a high-level overview of Medicare and the programs associated with it. We're happy to go into additional detail with you on all aspects of this program. Like I said earlier, everyone's situation is different and may require further discussion. If you have any additional questions, please call our office at the number listed, and we are available to assist you and further explain in more detail on this very important decision. We appreciate your time today, and we look forward to assisting you in your Medicare decision.